So, Dr. Abayomi Salawu, we meet again. Last time I saw you was in Sydney.
Well, nice to meet you too.
So, you had your cancer rehabilitation session today. Can you tell us a bit more about that? Because I've heard about it already. There's a lot of positive feedback around it.
Yeah, it's a good opportunity actually to get a message across, because this is an area rehab medicine physicians should be getting involved in. And it was a good session in that we tried to break it down into its basic steps so that people can see how simple and how easy it is for the specialty to be. And we are really well placed and well positioned to actually take a lead on this rather than other specialties delivering it. We're more likely to be successful in incorporating it. We know exercise and physical activity is meant to be a lifelong thing. What we do in rehab medicine is support people pretty much lifelong in terms of all the different things. So I think it's just a natural fit, and it was a good opportunity and a fantastic session with all the audience. Actually, the audience made it a lot more enjoyable. They asked questions and they interacted a lot more. Yeah.
Wow. So great to see this on the agenda for the conference. This is something you have a particular interest in, and it seems to be something that's well developed in Hull. What would you say to other areas that want to start developing them in their regions?
The first thing is interest. Any clinician or any physician that's interested, and I will encourage them, yes, to go for it in that. Because these are a group of patients traditionally have been neglected from a rehabilitation perspective in that, and most of them are actually able to engage in loads of different things. When I first mooted the idea of doing an exercise research in brain tumor patients, nobody thought it made sense in that. And I went around it in the sense that if you can show in the worst group it works, then you've pretty much made the case, and you don't need huge numbers. Whereas if it's a relatively easier group, you need huge number to show it works or it does things. And that was one of the reasons, because I know it's going to be difficult to recruit patients today. So that worked, and that kind of gave us because you've tested it, you know it works. You become more or less, I don't want to say a prophet, but more of a disciple to that program, and then roll it out and get as many people as possible. And you can use anything, like you're talking in terms of physical activity. You don't need to have any massive piece of equipment. Some patients, the only thing, in fact, initially when we started, you will laugh at this, I actually just went into Lidl and bought hand crank exercises. It was £15, so I bought 6. Okay, we put it on the wall, and of the 6 we bought, I only have 1 now because some patients took it home in there. So anything people can use, increase movement. Bottom line, that's what we're trying to say. We cloaked it in physical activity, we cloaked it in exercise, but the more active people are, everything improves from what we had in our session today, and that's what it shows in there. You move more, you get all the benefits in terms of it. Reduction in all-cause mortality, and we now know sedentary lifestyle or sedentariness, as they say now, is a worse risk, higher than alcohol, higher than cigarette smoking in terms of cancer causation. So it's not just even managing people who are diagnosed, we are also preventing or helping people in terms of preventing. So, and this, for me, I think the rehabilitation medicine clinician is best poised to deliver this. Best. Other people will be involved. Yes, oncologists, most patients listen to the oncologist. That oncologists have to be on board, but we look at a bigger picture rather than just treating and talking to you. And because we're not giving drugs, I think patients more likely listen to what we have to say in that. And also, when you're able to deliver some of these programs, it actually also gives patients the view that people are actually treating me more than just somebody to be treated, because I'm not giving drugs, I'm just talking of things to improve your quality of life. Oh, this person believes I can have a quality of life. So it fits all the both. There's so many unspoken advantages just by that interaction. And with our training and our ability to engage with patients, we sell it better than any other specialty.
Incredible. Well, I hope you can count me as a disciple, Yomi. Thank you.
You're welcome.
Great.